everyone. My name's Dede Montgomery, and I'm the lead for outreach and education, both at the Oregon Healthy Workforce Center as well as the Oregon Institute of Occupational Health Sciences, based here at OHSU. I'm also a certified industrial hygienist, and my role is critical in that I'm always looking and making sure that in everything we do around our research and around our total worker health, that we in fact are always considering traditional safety and health. And we remind ourselves that safety is fundamental to total worker health. So while during this response to the coronavirus and all of the challenges it presents, we need to remind ourselves that while we talk about social support and resources for employees and resources for supervisors and leaders and how we can support each other, and infection control and social distancing and all of those things, it's critical that we always remember when we're talking about the workplace, we still need to continue to do those things that work to keep people safe and healthy at work, including things that may not be related to the coronavirus exposure concern. And so I would remind all of us to make sure that we look at a statement that did come out recently from Oregon OSHA, which provides a really good reminder. And I'll just read that to you because really it's first and foremost, employers do need to understand that even in unusual times like this, employees are still exposed to hazards. And it is still the employer's responsibility to ensure that employees are adequately protected from those hazards. That means that we may have protective equipment and protective gear that is different than, in fact, the masks or the sanitation and the gloves, and those things are critical potentially around coronavirus exposure, but we cannot neglect the concern about other things. And in fact, maybe we need to think outside the box and change up parts of our jobs, but we absolutely want to still identify, evaluate, communicate about, and control those hazards. And really just finally, I would just leave you with those those kind of thoughts that we will continue to think about the hierarchy of controls. We eliminate that source, and that's why physical distancing is so critical. We want to really eliminate that risk of exposure. And in our workplaces, we are going to have potentially physical distance officers, people that is part of their responsibility. We've seen that working really well with some of our leaders in construction. We also want to, in fact, remember, we may need to instill some PPE and other things when we can't do everything else. And training, all of those things that we do around safety, we need to continue to do, but not neglect the important safety and health. I would encourage any of you to make sure that you're in touch with other partners in the state of Oregon. We want to stay familiar with what Oregon OSHA is saying and leaving on their website as messages for us, and those are updated regularly. Within the state of Oregon, we know the Oregon Health Authority is providing us daily guidance on news and, in many cases, guidance, including some for different aspects of our workforce. And outside of our state, then we certainly have our partners, our research partners at NIOSH, the National Institute of Occupational Health Sciences, National Institute of Occupational Health and Safety, and our other centers of excellence, which all are doing great work on this. So we're sending our thoughts to all of you. Stay safe, be kind, and we're all in this together.